Good afternoon, everybody. Maybe good morning for a few of you. My name is Haley Yates. I'm the manager of strategic solutions here at UBA. And on behalf of United Benefit Advisors and Innovu, I welcome you to the first presentation of our 2025 UBA Employee Benefit Webinar Series. Today's topic is gaining a competitive edge with health plan transparency and data. And our presenter today is Hugh O'Toole. As CEO of Innovu, Hugh's current focus is on how to change the advisor-consultant practice models from their siloed focus on health and welfare, retirement, and P&C to a practice model focused on the holistic human capital risk management. Through leading capabilities in data aggregation, data science, analytics, and behavioral finance, Hugh believes the industry can have a much greater impact with the convergence of data and benefit disciplines versus a myopic view. And with that, Hugh, the floor is yours.
Thank you, Haley, and really appreciate the welcome we've received from the entire UBA community. It's been great. Thoroughly enjoyed my time out in Palm Springs a couple of weeks ago. First of all, being from Connecticut, I just enjoyed being warm, but really enjoyed everybody's kind reception to your community. One of the most often questions that I was asked when I was out visiting with you all was, how do I actually separate myself from my competition? So when Haley asked us to hold this presentation, I wanted to put together a presentation that really just frames out how to separate yourself really through transparency, data, and then a process. The good news is Innovu, we're already working with about 10 UBA firms around the country. Thoroughly enjoy my relationship with those firms, and so does the rest of my team. So today what we're going to do is really just take a little bit of a journey. Haley said earlier, if you have any questions, don't hesitate to put them in the Q&A, the chat. She's going to watch that for me. Honestly, I love to get interrupted when I'm presenting. It will make it far more interesting for you all, for sure. So I thought we'd break the session into 3 different segments. Number 1 is just what is the current healthcare landscape? What is the government trying to get us to do? The middle section is really one of my favorite quotes. The Supreme Court judge, actually a very good school in the Northeast, is named after this gentleman, Louis Brandeis, but it is that sunlight is the great disinfectant, right? In capitalism, when you get to see the truth, really great advisors are able to help their clients. So that's a major theme. And I will tell you, just being a CEO and working with CEOs throughout my life, transparency is the way they run their entire organization. CFOs run their entire procurement and accountability process through data and transparency. And what we want to do in this session is really just help frame out that if you apply a process that the government is really demanding your clients use, and you combine that with data, you can create superior outcomes, and those outcomes will be what separates you from your competition. This is one of my favorite slides of my career. So my career really has been about how do you find something that's completely obvious in the capital markets that honestly everybody's making too much to admit it could improve drastically. And that's the way I look at healthcare and pharma, is we are very early in the process of transparency and data. And when you look at this journey up this mountain, most people are still at best in the benchmarking phase. And I'll show you how to get to isolation causation. And then working with great advisors like you on the phone, we can get to optimization. And that optimization will separate you from the competition. Throughout this presentation, I'll also share with you all kind of the last industry I was a part of that did this, and how huge a flight to quality it was to the best account management and producer teams in that industry. I think, the next couple of slides are things that you already know, but it explains a lot about the government's actions over the last 4 or 5 years. And candidly, with the new administration, it's only accelerating, but it always has been bipartisan since December 27th, 2020. The reason for that is where we are on healthcare spend right now as a percentage of GDP is totally unsustainable for the US economy. I know we've been saying that for a long time, but I guess what I'm saying to you, it really is. And the government realizes it. And when the government can't control something, just remember, and this comes out of 2 secretaries of Health and Human Services directly to me, one a Democrat, one a Republican. When the US government can't control something, they will actually put the American employer in harm's way, knowing that when you put the American employer in harm's way, they will actually correct an industry. The reality, too, is that candidly, the first move with this unsustainable cost that's affected the government, but really has affected employers, was most of the consulting was about how do you cost shift that onto the actual employee. The reality of that is we are in a very tight labor market. I can tell you, as somebody that has about 85 employees, I cannot cost shift more of the healthcare spend over to my employees, or I will lose my best talent, right? So that's a little bit of the rock and hard place that we're currently sitting in. So I kind of hinted at this, but the reality is that government has been trying to regulate the insurance industry and the healthcare industry in general, and they have failed. So what did they do post 2020? They actually made the plan sponsor the big F fiduciary, very similar to what they did to the plan sponsor, which is most often the employer, back in 2006 in the retirement industry. What do they want to happen? They want to see the expenses curbed. They want to make sure that the outcomes for the employee and their dependents is better. And they realize, based on everything they're hearing from their constituents, the cost of healthcare, the cost of pharma specifically, the ability to get mental health and substance abuse help. These are the things every single congressperson is attacked on by their constituents when they go back to their home states. So let's just kind of go through this really logically, right? So just by background, I was part of the last transformation in the retirement industry. So just to give you some background, when I started in the retirement industry, I know this makes me incredibly old, but unfortunately it's true. I started working in benefits in 1988. For the first 4 years, I worked in the healthcare side as an underwriter. And then I was asked to take over our retirement division. That retirement division focused on nonprofit employers. Back then, if you joined a tax shelter annuity plan, the expense ratios in that tax shelter annuity plan, the investment product was probably a variable annuity, and the all-in expense ratio was 3.5%. Okay? I won't go through the entire progression, but then right around 2006, there was something called the Pension Protection Act that was passed that made the employer the fiduciary and put the liability on the plan sponsor, that employer. And then they also, for the first time, made the insurance companies, the mutual houses, the banks, the advisors admit to what the expenses were and how much they got paid. In the retirement industry, they call that 408B2. That legislation was met with just kind of like, oh, okay, we call that the complacency phase. And then the lawsuits started. And then that created what we call a well-adopted fiduciary process. Why would you care about any of that? You probably don't. But I would imagine every one of you on the call is part of your own 401k plan. So remember, at the beginning of that process, the expense ratio was 3.5%, still very attached to that industry. Today, if you're paying more than 0.5% in your 403b 401k plan, something is actually wrong. So that 3% not coming out of your 401k every year will mean hundreds of thousands of dollars for you and every single American. That's why the government did it, and it worked. So guess what they did is they're now applying since December 27th, 2020, they're now applying that same set of laws to healthcare. So your clients are now the big F fiduciary of the plan, really for the first time since ERISA was passed in 1974. And they are putting the same parameters in place. I'll go over them quickly with you. I would say for the first 2 years, I was out like Don Quixote, an evangelist telling this story with very little reaction from the market. This is now one of the hottest areas, and I'm asked to speak all over the country. And employers totally get it. So that complacency phase is over. And actually, we're over 25 lawsuits that are being applied based on this law. Some of them are class action lawsuits, like the Mayo Clinic, like Johnson & Johnson. Some of them are the Department of Labor suing insurance companies directly. Some of them are labor unions suing the insurance companies. But everybody realizes that this law changes the entire playing field for healthcare pharma consulting. Out of this, we're looking to get to a well-adopted fiduciary process. Guess who runs that? That will be run by really good advisors that understand process data and transparency. So this is something I do every day, not as the CEO of Innovu, but I am the founding member of the Center for Board Certified Fiduciaries, and I run a program specifically to get advisors certified on how to be the personal trainer for that plan to follow the law. But more important than following the law is by following the process, you will be able to find huge savings for both the plan and the participant. And using that same process, we should be able to drastically improve the healthcare outcomes for the American public. All right. Don't forget, please don't hesitate to put a question into the Q&A or chat, and Haley will pick that up for me. So with that said, obviously this is a pretty significant law. I just want to go through a couple of the provisions, the major provisions. It's sort of like raising kids. There are two where the government is removing obstacles so the plan can be a better fiduciary. And then the bottom two, like all gifts, come with responsibility, and the responsibility is to actually do a better job for the plan. So the first one is called removal of gag clauses. Just so you know what a gag clause is, and as a data warehouse and provider, we see these all the time. And although it was written into a law in 2020, the reaction from the people that have gag clauses has not been quick or smooth. So I'll just give you an example, and I'm not talking about just on a 200 life case, but this on a 7,000 life employer. That health insurance company said to the employer, if we give you your data, right? Listen to that pronoun. It is the plan's data. It isn't the carrier's data. If we give you your data, if you leave us, you need to destroy your data. When we give you your data, you're not allowed to use that data to quote against us. If we give you your data, you're not supposed to compare the hospitals and providers in the network. These are all very clear examples of what I would say are illegal gag clauses. And candidly, every one of them, if you consider yourself a fiduciary, which these plan sponsors are, if you don't do them, it would actually be a fiduciary breach. So a gag clause is, at its simplest definition, is somebody's going to actually keep data away from you as the plan, or when you get to data, they're going to restrict the utilization of that data. All right. Second is just as important. When I was showing you those two timelines between the 401k industry and healthcare, I said they called something 408b2. That's identical to box number 2 here. And what box number 2 says is if you are supplying services that cost over $1,000 to a healthcare plan, you need to disclose not only the direct compensation your client would be aware of, but you have to disclose the indirect compensation that you get from working with that vendor, so the client can assess that total comp and whether you, a TPA, a PBM, actually justify that fee with the services provided. A lot of people think this is solely so that people can price check. It actually isn't. That's one of the reasons, but I would call that the minor reason. Really, what the government wants to encourage the plan sponsor to look at was the advice to go to, say, insurance company, PBM, based on the brutal self-interest of the service provider, or was there actually a fair search due to the fact that all compensation for all solutions were properly represented? Very important. Number 2, I will say, and I haven't seen this reaction in mass yet happen in healthcare pharma consulting, I will say that was the number one reason plans moved in the retirement space, was just the shock from the plan sponsor that there was indirect comp. So just to give you why I am so committed to working with you to understand the law and its ramifications, when people started to actually get to full disclosure, that cut the amount of retirement advisors in the mid-market down from over 270,000 advisors down to 5,000 within about a 4-year period of time. So this is a huge opportunity for all my UBA friends to get on the front side of this issue in their prospecting meetings, and also to make sure your clients know exactly how you're paid so that they're not asking you after somebody has mentioned it to them. The two other areas, and we won't spend a ton of time on this in the law, is to make sure your client is doing their annual reporting for pharmacy and prescription drug disclosures. That's an annual mandate that has to happen. And then once again, there's an annual requirement that you do a parity analysis for your clients to figure out the parity of access of substance abuse, mental health to the rest of the health plan. So really important that you're aware of the law. This is somewhat just like shocking to me. None of this happened. This level of clarity did not exist in the retirement space, but we just had the second FAQ come out from the federal government, and 3 different departments weighed in together, pretty much saying to the industry, we're not kidding. You need to get rid of those gag clauses. You need to include the following data in your information. It has to put the plan sponsor and their advisor in a position to freely benchmark, and they have to share data. They should be allowed to share data with other solutions off of the data they get from you. This is really important, once again, because with transparency, your ability to procure and hold solutions accountable is so much stronger as an advisor. So, and I don't know what I could do for somebody to ask me a question, but whatever it is, I'll coordinate with Haley to send you a gift. But if you look at it, right, we're talking about the law. I would just say there's a very simple process for meeting the standard of being a fiduciary. Once again, I spent about 25 years in the retirement industry. We really did perfect this. Your clients are used to this in their retirement plan. And this is really just a rinse and repeat applied to the healthcare plan.
Hey,
So
Hugh,
yep.
we got a question.
Awesome. You'll have to make sure you get the name so I can send them a gift.
Okay.
Yep.
So the question is, how do we get this message across to the bukas?
Yeah. So we do collaborate with advisors to tell this story to the bukas, right? So the legislation's very clear. I am aligned with a number of the leading attorneys in the industry. We are finding their first reaction is business as usual, but I would say I've been running Innovu for the last 6.5 years. We load well over 200 new clients a quarter. I would say in the last year, less than a handful, I think the number is 3, we were not able to get them budge on the loading of data. The other key is really to use an attestation process to say, our understanding is there are no gag clauses in accordance with CAA of 2020. And then the other big missing piece, I just was on a homily on this with my own people this morning. We can also give you the RFP language so that when you go out to bid for your clients, you have the correct RFP language to make sure you're going to get your data. There'll be no gag clauses in order to start the fiduciary process. So once again, there's plenty of techniques. You still will get resistance. It's not a clean road, but very, very rarely now clients don't get their data. I do, as I hear myself speak, I would also say, I just want to be very clear. You will get your own data in self-insured plans. In fully insured plans, we do get some level funded, we do get the data. In fully insured, you're not going to get the data. So you have to rely on this process and benchmarking more in fully insured due to the fact that for now, the insurance companies are hiding behind their black box in fully insured.
2 more questions, Hugh.
Cool.
The next one is,
Now people just want gifts. I get it.
how do you engage employers and advisors around this fiduciary process, making them excited rather than fearful?
Yeah, I think I'm going to get to that. And actually I learned this from a UBA advisory firm, True North. Really taught me this is we were doing seminar marketing to their prospects and clients. And we just said, you know what? This is really just proper procurement and accountability. So 75% of the story is how we're going to use the process, data, transparency to save the plan and the participants money. And we would just kind of finish with, oh, and by the way, it's required. Versus like, we're going to scare you make you do the ostrich and say like the IRS and DOL is coming to take your baby away, right? So I do give True North credit everywhere I am because they really set my head straight. And I do this with advisory firms all the time. And I think as we go through the application of this, you'll see it really is a huge financial benefit, outcomes benefit that just happens to be required. Hopefully that made sense.
Yeah, we've got two more. The next one, what about the high fees the carriers want to charge to get the data to a data warehouse?
Yeah, I consider that a gag clause. So I would say, and I have attorneys that are willing to write letters for you and I that consider that a gag clause. The other thing you should realize, and this is really important, that is a great delay technique from the incumbent. If they don't waive, the way the law is written is you have a responsibility to go out to bid and replace them. So just bad actors don't actually relieve the client of their fiduciary responsibility. I would say also get that documented and make sure it's in a file for evidence.
Okay, and
Okay.
last one here.
Yep.
The downstream gag clauses are the issue, the providers. Not sure I am using the correct terminology here, but is this like the 32BJ contract language?
Yeah, so that's a great so 30 that's a great example of massive savings. But yeah, so that's actually I've actually been on panels with the woman that ran that process. So for people that don't know, there's so much to that question actually, but they use the new publicly available rate data that we have as well. And they realized that Columbia Presbyterian was overcharging with poor quality in that hospital delivery system. So they actually used the data to remove them from their network and gave out a stipend to their union members due to the fact they were able to create that savings that eventually had kickback. And I believe Columbia Presbyterian, I shouldn't really say this, I think it's taped, but they took some very aggressive action to try to make the union retract that move. So very complicated issue, but they absolutely played a dirty game to try to remove what was a very prudent decision from the union leadership. So more than happy to speak to that person at greater length in a non-recorded line. So, but much more to that story.
Thank
Okay.
you. That's
All
all of
right.
them for now. And just quick time check, we got about 15 minutes left.
Yep. So I'm just going to move through very quickly these 5 E's. So number one, most importantly, if you're in a self-insured plan, your client should own their data. Very basic. A fiduciary wants to own their data and they don't want to lose historical data because they switch carriers or PBMs. So number one, make sure you own your client's data in a data warehouse for all the things you're about to see. Number two, this is exactly what a couple of the unions are suing the Bucas on. Real quickly, that same data set that the union used to evaluate Columbia Presbyterian, 2 unions in my state, Connecticut, are using those purple bars of what the public rate data says they should charge for this procedure at these hospitals. And then all we do is we put that up against your actual client's paid claims data to say, should you have an uncomfortable conversation with the carrier on why your client's claims data is higher or lower than what they publicly disclose they would charge. So this is the type of curiosity a good fiduciary has using data. This is just to cut to the chase. And I from hanging out with you guys, hitting golf balls that night, I know a number of you get this, but there is no correlation between cost and quality in healthcare. So you're going to want the data to get in the way of your decisions by evaluating cost and quality metrics off your client's loaded data. Okay? And this is all part of exploring as a fiduciary what's going on in the plan versus just installing the next shiny toy that the industry throws at you. And with loaded data, you really can see what the risk distribution is in your population by relationship, who's kind of low current risk, high future risk. Those are usually adherence issues. Who's high current, high future? Those are probably procurement opportunities because those diseases aren't going away. And then you can look in aggregate, what are the areas you're going to want to make sure the carrier, the providers are paying attention to because they have greater prevalence in this given employer population. So that's just a fiduciary is going to explore data. Then, and think of the exploring part probably is going to start up, March and April, exploring what you need for the next renewal, what actions you'd want to start to look at. Probably mid-spring, early summer. In Connecticut, we're hoping to God that actually happens one day. But you'll start to envision, okay, in the data, I have pre-diabetics that I would like to not become diabetic. So just looking at the data, we can see if you can solve for that, it would save you about $125,000. If I don't get in front of this risk, it's going to cost the plan about $250,000. So you're starting to envision, this is just examples, by the way. You're envisioning something you're going to want to look at. You want to look at it in this group because their prevalence of diabetes is already higher than the benchmark. Okay, so again, benchmarking is a huge part of being a fiduciary. What does a client look like that looks like me? Am I running hotter or colder than a similar population? Then you're going to execute, right? So let's just say we don't advocate any point solutions, right? Innovu doesn't get paid on any product offered, right? So, so what we're going to do here is we would identify the diabetic population. Then you would, in this case, a UBA consultant says, I'm going to carve that out, put that with Livongo. We get an indicator from Livongo on who they're working with, and then we actually look at it, right? And we're going to examine whether that point solution justifies its expense. So do the people that participate in Livongo outperform the non-adherent participants that don't work with Livongo? Once again, I endorse nobody. Data tells the story, not Innovu, right? But in this case, they are actually justifying their expense. Okay? The other beauty is as you go through this process, and I met a great firm from Maryland at your conference, they actually are very big in retirement, obviously big in healthcare pharma, and they have a P&C shop. As you load data, now healthcare pharma data is the richest data set you could have on anybody. But now you start to complement that with the other data sets, and you truly are getting into human capital risk management and a true seat with the C-suite for strategic planning. I just want you to know that's available. And then it really just circles back to a fiduciary process. And if you don't like the word fiduciary, if you feel like that's too scary, I would just say everywhere we say fiduciary, it's just you would represent yourself as I'm an advisor with a very disciplined procurement accountability process. So I'm spending the plan's money in the most efficient, effective way to create the best outcomes for your participants and you as an employer. By the way, if you said that after everything you did, you've actually protected your client from their fiduciary responsibility. All right. So I know hitting time is more important than almost anything. So I just want you to know, really cold hard, if you don't take anything else away from this, it's imperative that your clients own their own data for movement, for trend analysis, all of those good reasons. You do want to make sure that the solutions you're putting them in front of, you're not conflicted and they're not conflicted in the sense of an ERISA plan. You're going to, whether it's fully insured, level funding, self-insured, lean hard on process. Where you can't get data, lean even harder on benchmarking. Oh, by the way, you want to document everything you're doing and keep that in a file so that if the DOL audits your client, they're protected. Really, another important point, ERISA and a fiduciary standard don't judge you on whether they think you got the best outcome or not. It is judged on whether you followed a process and can show your intention was to get a solid outcome. Whether you succeed or not, you're actually protected. And then again, that 75-25, we're going to do this for all the right reasons. Oh, and by the way, it's required. And candidly, I would just tell you, by doing this, and you have firms that are part of UBA doing this today, this totally separates yourself from the competition and will help you both grow your business and retain your existing business. So with that, I'm going to turn it back over to Haley. I really appreciate the time you spent to hang out with me for 45 minutes. And whatever me and my team can do to help you, please let us know.
Awesome. Well, I know it takes an extra second or two to type a question, so we have a few minutes left here. If anyone wants to get something into that Q&A, please feel free. And in the meantime, I just want to thank you for your thought leadership and sharing your expertise today. And thank you to all the UBA partner firm employees and any of their clients who joined us today. Our next webinar, as you can see, will be on March 18th, and the topic will be exploring a captive strategy, which will be presented by Mick Rogers with Alliance Healthcare Coalition. So thank you again for attending our first UBA Employee Benefit Webinar Series of 2025. We look forward to you all joining us next month. It does look like we did get one more question in here. The question is, you mentioned RFP language to ensure data release. Are you able to share that?
Yes, we'll get that over, Haley, to you, and you'll help us the most appropriate way to distribute it to the group.
Sure.
And Haley, I'll need the list of the people that ask questions so that I don't make myself a liar.
Okay. Anybody else with questions? And if you think of something after the call, please feel free to reach out to me directly, or Hugh as well and his team. They'd be more than happy to help you guys out, but we'll get you to the right person afterwards if you think of a question. With that, I guess we'll end it for today. Again, thank you everybody so much for joining, and we'll see you next month.
Great. Thanks, Haley. Take care.